Hi, my name is Craig Hall, and we're going to talk about social media and public health education. And in this training, we're going to explore strategies that local health departments can use to enhance community engagement using social media. If you follow me and have been part of any of my trainings, I like to remind everybody this one simple but very important thing, that even though we're talking about social media, there is no one solution to public health communications, and that we need a balanced mix between online and offline communications in order to combat public health message fatigue and establish a two-way communication between local health departments and the population. In everything we're talking about, we're really talking about a digital first approach, which really means how do we communicate with populations in a digital age? It's not a question of digital versus traditional, but rather a question of how to maintain connections and communicate in a digital world that we live in today, knowing that there are members of our community who are not digitally connected to information. In this training, what we're going to look at is we're going to look at two primary aspects of social media. We're going to focus 99.9% on the community engagement side for the purposes of this discussion, but I don't want to forget about the big data analytics side for those of you in the audience who are looking at how to leverage some of the macro level patient data or data that's coming out for self-management and some of these other challenges that we're trying to address throughout the healthcare delivery system. Strategies to distribute content via social. What we're looking at is we have to create original content is one potential solution. Something I know can be very challenging for organizations of all sizes. Sharing published content from thought leader networks. This is one that I think is probably one of the most easy ways to get involved and jump into social media very quickly. Along that kind of comes liking, commenting, and sharing other people's information, and that dovetails right into that thought leader networks. And when we're talking about thought leader networks, we're talking about some of the national and large regional organizations, the American Diabetes Association, and organizations like that. And in this training, we got a lot of examples to show around how we can look at the different networks that are out there and the different thought leader networks to address some of the top public health priorities in our region. And then influencer networks. How can we leverage influencer networks? Local health departments are influencer networks. Our provider networks are influencer networks. Our patient advocacy groups are influencer networks. Our chambers are influencer networks. And there are a host of influencer networks that I haven't even thought of, but I'll go through 18 that I've identified within the region, and those don't even account for some of the patient advocacy groups and some of the coalitions and the rural health networks that exist. And then social media ad networks. This is where I'm going to spend that 1 minute talking about big data analytics. So we can leverage personal data, email addresses, and user interest levels to distribute messages, whether they're ads or posts, on social media. Similar to what we did in our email and text-based messaging, where we can leverage that personal data to provide nurture messages and follow-up messages. We have that capacity to do that type of activity in social media. If anybody's interested in exploring that a little further, please contact me. I'd love to have a conversation with you. The focus of this is really around some of the basics of getting started in social media, but I want you to know that we have the ability to target people if we have some basic information, such as their email address or an interest graph or some things that they're interested in on social media. The engagement versus the broadcast type of social media. So, when we're talking about engagement, we're talking about using our networks directly via our individual organizational profiles, our individual personal profiles, and then leveraging influencer networks. And I want to just circle back around this influencer network topic. Influencer networks are those people we have they're stakeholders, people we have relationships with that can help us to expand the reach of our message. Within our region, we have Albany Medical Center, we have St. Peter's Partners, we have Ellis Hospital, Saratoga Hospital, we have all the local health departments in our 6-county region. We have our chambers in Rensselaer County, Saratoga County, Albany County, and Schenectady County. So these kind of make up a group of influencer networks. We have various coalitions, we have various patient advocacy groups, local, regional, state chapters for various patient advocacy groups. Those all become potential influencer networks we can look to ask them to share our messages. And then the paid distribution. We talked a little bit about this a moment ago. And in paid distribution, what we're really talking about is using personal data to kind of broadcast or target our messaging. Because there's so much emphasis on really justifying where we spend our time, money, and resources, and it's not just local health departments, but all organizations. If we're going to make a case for spending time on social media, then what are we going to get out of it? What is the probability that we're going to actually have an impact? Because sometimes we look at social media and we mistakenly say, oh, well, this is free advertising, or it's free to do. It's a very low-cost medium in which to communicate with the public, but it's not free, because you need people, you need to have the organization and the strategy, and you got to make sure the right content's being put out, and then you got to monitor it. So nothing's really free in this particular scenario, but this is a great low-cost way. So just look at the rise of social media. It's definitely starting to plateau, but when we look and see that 78% of adults in America are using social media, we have to take a moment and really look at that and say, while there may be varying degrees of engagement, we know that there is a lot of people across our communities and across our country who are spending time on social media. So know thy audience, segmentation, something that I'm a big proponent of, something you've all heard me talk about a lot. And when we start talking about which social media platforms we want to use, we really have to have a strong sense of who we want to reach and what our audience is. So what we've kind of done is we've kind of looked at this again through the lens of our top health priorities, or those prevention agenda items here in the capital region. Asthma, diabetes, obesity, mental health, opiate substance abuse, and then suicide prevention. But what we're talking about really, it helps to address all health priorities, but we've really framed our examples and our discussions around the top priorities that we're all working together to address within our region. So I want you to just take a quick look at this, and going back to that statement of know thy audience. On the face of it, we see Facebook having 71% of all users online, and are all social media users online. So when we look at that, if we had to pick one channel, Facebook is definitely probably the one that we would want to start with. And Facebook is very powerful, has a wide reach, has a very broad demographic base of users in it. But when we start to really break it down and we start to look in some of the the sub audience sectors here, we really start to see a slightly different picture. But we're looking at Facebook, Twitter, Instagram, LinkedIn, and Pinterest. And this is just a quick slide to really kind of explain a little bit about how it breaks down by age groups. And it doesn't have that adolescent audience in it, but if you look and see Facebook in that 18 to 24-year-old demographic, it doesn't have very strong penetration. And as you go into that adolescent age group from, like, say 13 to 17, we actually lose a little bit more penetration in that particular audience. So if we're looking to reach a teen and young adult audience, we need to look at things like Instagram. And while Snapchat is very, very strong within that younger demographic, there how public health and local health departments can use it isn't exactly clear to us yet. But I think there's something we can learn about the phenomena of Snapchat that we can certainly apply to the type of content and the type of information we share, especially when we're trying to reach that younger demographic. I'm going to run through a quick snapshot of a few high-level statistics. But so look at Facebook. 71% of adults on the internet are using Facebook. 58% of the entire adult population in the United States. So obviously very large network, lots of engagement, and probably a place we want to start and definitely consider. But as I've said, that adolescent engagement on Facebook is in decline, and even in that young adult population is in decline. It's not to say they're not there, but we're seeing decreasing numbers of individuals in these age groups participating in Facebook, and I expect to see that continue to decline. Twitter. Lots of people ask about Twitter and what's the value of Twitter, and I think that what's important to remember is that Twitter definitely has a place in the social media distribution. It's these little micro, really short messages, but we see 23% of adult internet users on Twitter and 19% of the entire adult population. Instagram. So 26% of the adult users, 21% of entire adult population, but 53% of adults age 18 to 29. And we don't exactly have the data for the adolescents, but as we said before, we really do expect it to be very comparable, if not slightly larger, because what we've seen is a very strong movement toward image-based communications. Pinterest. Pinterest is very strong among women online. I don't think that we look to implement a Pinterest page or a Pinterest strategy out of the gate, but if we have a health priority that's really geared toward targeting women, Pinterest is a place we should certainly consider and look at. In LinkedIn. LinkedIn is a bit different than the other networks. It's more in that stakeholder, professional arena. What you share and how you share is a bit different than what you would see on Facebook. But as we're looking to broaden and expand our social media campaign, LinkedIn is a very important place, especially for stakeholder and influencer network engagement. Looking at adding LinkedIn and maintaining a LinkedIn page, certainly can help us to kind of reinforce that message and have an additional place that those public health messages are being distributed. As I said, we don't really have any exact recommendations to make on Snapchat, but the phenomena of Snapchat is something we must pay attention to. According to Forbes, 37% of Snapchat users between the ages of 18 and 24, and over 60% of the U.S. 13 to 38-year-olds are Snapchat users. This statistic is mind-blowing. 500 million Snapchat stories per day at 10 seconds each, with the average user spending 25 to 30 minutes each day, means that every day we're producing content that would take us 158 years to watch. It's unbelievable. And what does this tell us? What is Snapchat? And so for those of you who aren't familiar, Snapchat's very similar to traditional texting, except there's these little photo and I guess animated or short video clips that are sent to friends and they disappear after 10 seconds. But what it tells us about behavior and about what this age group is really after is short, high-impact images for entertainment and social connection. Short or quick, high-impact images. So if we know that that's what's driving their engagement and driving their behavior, that can help us as we start to shape and think about how we want to structure our campaigns, structure our content, structure our Facebook messages, and they definitely need to be accompanied with an image or a high impact graphic of some sort. So the next couple slides, what we're going to look at is we're going to look at some examples. So what we did is in just starting to get local health departments and other public health planners thinking about how they can take advantage of social media. So Boulder County Public Health Department. So here's an example of how they leveraged content that was being published. So they didn't have to create any new content. They leveraged content that was being published on the New York Times. It was around the epidemic around opiate abuse, substance abuse, and they copied and pasted that right into their feed. So for organizations that have identified opiate substance abuse as a top priority, here's an example that of how you can easily spread and enhance the distribution of that message by only clicking on a link on the New York Times and pasting it into your feed. Here they are addressing diet and weight management and healthy eating by sharing an article, another New York Times article, that has a little tool on it that ultimately is geared toward getting people to think about calories and grams of sugar in their diet choices. Again, this is the ability to share something that they don't have to create any content. They are simply curating content or going out and finding other people's content that helps to tell their story and address their health priorities. Lewis County Public Health. So Lewis County is a New York State Health Department up near Lake Ontario, and they seem to be very active on social media, and they're sharing some information on community events. And here you see them sharing some infographics on Twitter around Cervical Cancer Awareness Month. They're on Instagram. And this one actually caught my attention as I was preparing for this, because this is actually a public health department in Ireland, but so much of what we were talking about throughout the region and throughout the state and throughout the country for that matter is keeping emergency departments for real emergencies. And I just thought they did a great job of addressing the issue and putting it out graphically that at least makes people pause and think. Obviously this has to be blended into a much larger campaign, but I thought it was worth sharing because this is something we're all addressing and looking to address. So now what we're going to move into is we're going to move into some examples of thought leader social networks that can help us to address some of the top prevention agenda items here in the region. And the goal of these is, when we're looking to start our social media initiatives, is to not create a lot of work around creating content, but following those thought leaders. And this is something public health does today. This is something public health is great at, is finding the things that the CDC are putting out there, finding the things that the American Diabetes Association are putting out there, and sharing them with the community. Well, we can do that on social media too. So here is the CDC program, or the NDEP program, and it's basically, if we were following them and they shared this piece, which they shared in December, we could just share it. We could click that share button and share it to our page, and that message would be pushed into our networks and into our community, and that's all we'd have to do. The share button, add it to our page, and then we would then be able to use this within our own communities to kind of promote the change begins with just one step, kind of dovetailing into, some of the, next slide is geared toward obesity, but a lot of overlap in the types of message we want to share. Here they are on Twitter, talking a little bit about dieting and menus and food options. Again, if we thought this was something that they shared from American Diabetes educators, we could share it. And again, this would push into our communities, into our networks here within the region. Here's some examples on Pinterest and how it might work on Pinterest. So, if we're looking to, develop messages that are, really geared toward, women online, and, but importantly, it's not about starting with Pinterest, but knowing that there are resources already out there if we feel Pinterest is an important place for us. American Diabetes Association out on Twitter, and on Instagram. This one I thought was interesting because the Junior Diabetes Research Foundation, they're sharing a collection of things, but part of social media is about entertainment and entertaining people. So what they're doing is they have a Travel Tuesday blog, and they're basically packaging in what it takes to manage your diabetes around a really interesting lifestyle story. Kids that are able to travel abroad and do all kinds of fun things, and they're not letting diabetes stop them, which is really geared toward how you make the right eating choices, how you monitor your blood sugar levels, how you monitor your insulin levels, how you ultimately, manage your diabetes so you control it and it doesn't control you. But it's fun, it's visually impactful, and something that may have a place. Obesity. So the CDC Obesity Network, or rather the CDC Obesity Program, they're sharing things that are geared toward adult and childhood obesity. And if we're following them and following their messages, we can simply like or retweet or share the information they're putting out. Here's a group that's on Facebook that is putting out a lot of information on healthy eating and exercise and things that we can use to just quickly address some of the messages around obesity. And again, all of this is designed to get public health departments up and running without them having to create any new content. Now, yes, you're going to want to create some new content along the way, but that takes more time, and the review process takes more time. But by monitoring these networks, we can really ramp up very quickly in how we build and share and grow our region's ability to communicate and connect on social media. Here's some infographics and information that's available on Pinterest to share. And the same on Pinterest geared toward childhood obesity, which again would really be most likely geared toward a woman audience versus a male or female audience versus a male audience. Not to say that spreading this to male audience is not important, but we know that across the country, women tend to have more of a stake in managing childhood health. And now we turn to asthma. The Asthma and Allergy Foundation of America, sharing a lot of great information, not just about asthma, but about all allergies and things like anaphylaxis awareness and allergy management. It is a public health priority. It may not be on the top of our prevention agenda items here in the region, but asthma most definitely is, and here's a network that's sharing a lot of information that we can also in turn share. Here they are on Twitter and sharing things that kind of really dovetail into our Healthy Neighborhood program, around allergens in the house and how your environment can trigger asthma attacks and lead to chronic asthma. Some information for pregnant women with asthma and how they can manage their asthma during their pregnancy. On Pinterest, again, a lot of great material that's ready to share. Opiate substance abuse, Drug Free America, Partnership for Drug Free America. This is another network, a thought leader network that's out there that's really, or this is Partnership for Drug Free Kids. But so, sharing information. Now, what you see here is kind of a blend where, clearly we're targeting parents. Guess what drugs my friends use most, and then, when you click that, it's ultimately taking you to, a questionnaire in an article that, really is designed to educate parents on, what we need to be looking out for with our kids. Here was one when I had put this together. It was around the time of the Golden Globes, and they were using some mainstream media and some of what was happening in Hollywood to address the issues around opiate substance abuse. If something doesn't feel right or doesn't seem right or doesn't fit your department's mission, you don't have to share it. You only share the information that is meaningful and relevant to your local health department. Here they are on Instagram, which means they're well positioned to engage that younger audience. And on Pinterest, there's a lot of great information around substance abuse and opiate abuse. And we'll close with suicide prevention. American Foundation for Suicide Prevention, sharing a lot of special interest type stories and things that we can again selectively share if the right information or the right stories are published. This is a great one that reminds all of us that if we have loved ones who are at risk, not just to think of the holidays as a time of year where they're at risk, that check in with them throughout the year. And this is kind of something that we all need to remember, and we can easily again, by just sharing, liking, retweeting, push this right into our community and remind the rest of us that this is important, and that our family members and loved ones and friends who are at risk need us to reach out to them throughout the year, not just during the holidays. Here they are on Instagram. A lot of great information on suicide on Pinterest. And we didn't spend a lot of time talking about LinkedIn, and that was kind of by design because we want to really focus on some of the other ones. But here's an example of an organization that's on LinkedIn, and we can very easily build our local health department's LinkedIn page if that's a medium that's appropriate, or we have the resources to manage. But if we had to pick one and we had to start someplace, I'd say we start with Facebook and then we build from there. So here are the 18 influencer networks that I identified initially. Now again, this is not a comprehensive list. There is 2, 3, 4 times the number of what I've identified here. But this is a place to start from. And when we break this out across our 6-county region, some of our counties are in here. There's only a handful of relationships that each county needs to go and cultivate and communicate with for things that are related to shared distribution of public health messages. So some of the next steps and potential actions that I think we all can take is follow some thought leader networks, share or document appropriate content. And when I say document, so some of us don't have the ability to just decide and share the information that we want to share. So we need to send it to somebody else in our organization for review and approval, and then have them share it. So we may need to follow these networks ourselves and then document. So when you have the American Diabetes Association sharing something, we say, ooh, that would be a good thing to share. Or when we have the drug-free, Partnership for Drug-Free Kids sharing something, we say, that would be something we want to share. In that case, we may have to document it. So basically, take the link and send it to the individual to post or share. And that's what I mean by document. If we have the ability and we have the authorization to approve it, we can just share it directly. And then connect with relevant influencer networks to coordinate distribution of content. And those influencer networks are those ones in the region, our local and regional networks. And to build those relationships and to build those collaborations. One way to do it is just to get into social and start sharing and commenting and liking their information. But the other way is to actually pick up the phone or sit down and have a cup of coffee and tell them about what we're trying to do. That we want to address asthma in our community, and this is why. That asthma, across the United States, it accounts for $53 billion in healthcare costs, and within our region, we've identified it as one of the top priorities that we need to address, and we have some great programs like the Healthy Neighborhood Program, and the programs designed to go into homes and provide a level of services to help people improve their living environments. And maybe it takes a conversation. Same with diabetes. Same with substance abuse, suicide prevention. We may have to actually have a conversation with those influencer networks. But once we have it once and they get it, and we collaborate with them a little bit to make sure we're sharing information that they can share that achieves their mission, we're going to start to see some real growth in the distribution and expansion of these messages across our region. And then the last one, monitor other networks to inform your social strategy. So maybe you're not ready to pull the trigger. Maybe you haven't gotten authorization, or maybe you've got a page up, but you're still not really comfortable or sure where to move. Follow some of these examples I've shared with you. Follow the Boulder County Health Department. Follow the Lewis County Health Department. Find some other ones. See what they're doing. Get a sense of that to shape your own strategy. And finally, if you have any questions, give me a call, shoot me an email. Happy to talk further about this. If there's anything I can do to help, please let me know. And please, don't hesitate to reach out and ask questions. Thank you for your time.